Hi, my name is Palazuelos. I'm a physician, I'm an educator, I'm an implementer in this field we call global health, and I have had the pleasure for over 20 years working at both Brigham and Women's Hospital, Harvard Medical School, and the non-governmental organization named Partners in Health. There is nothing like walking with somebody through a space that is genuinely not available to the vast majority of the population. People who live in poverty live a very different reality than what most people in what we'll call the moneyed world live. I care a lot about that space. And even though I probably spend the majority of my time in the moneyed world, I'm always considering how to bridge those worlds, because ultimately we're all human. There's no reason why so many of our fellow human beings have to live in squalor when really there's just tremendous wealth. And so how do you get people, either young clinicians, global health practitioners, or allied folks, how do you get them to not just understand the problem, under 5 mortality? I think that's bad, sounds bad, versus I care about this because that kid is really cute and that parent is really trying their hardest. And this really is a tough context. I've seen it. Now, mind you, I would love to take all of our colleagues and supporters on a walk with me through rural Madagascar. But we can start, especially if some of these folks have health issues or are a little bit older, and that would be a tough trip for them. We can start with these 360 videos. I know here you had Matt Bonds, who works with Pivot. I visited them, shot a 360 video with all the equipment from my Burke grant, and ultimately they used one of the 360 videos in one of their webinars and to deepen their relationship with donors. And for me, the Burke was an opportunity to take an idea, get a success immediately, but then have space to play and explore and go deeper. And I think that in exploration and in play, we have the opportunity to find really unique things that don't currently exist or that are ahead of their time. And I'm proud to say that the Burke supported me to do this when I was the only one thinking about it. Now, that's not a flex. I'm just saying, thank you, Burke. Thank you, Burke, for seeing and for providing that opportunity at such a nascent moment. And it allowed me to get into the conversation in a very early point. If anyone right now is feeling hopeless and you don't have an opportunity to engage in hopeful action, take the time to prepare to repair. You will get your opportunity. And when we get our opportunity, we have to make sure that we have really good ideas, that we have plans, that we have clarity on what works and what didn't work. Let's study what we did. Let's interview each other. Let's talk. Let's sit in communion. And then when our opportunity comes, let's do it better. Each time, let's do it better and better and better and get ever closer to these great ideals that we have of hope, equity, rights, democracy, and the like.